Hi, we are live on the HIMSS 15 floor, and I'm at Sandlot Solutions booth, and I'm here with Dr. Tom Deas. Tom, tell us a little bit about what you do.
I'm a gastroenterologist. I've been practicing in Fort Worth for the past 25 years. I work with North Texas Specialty Physicians, which is an IPA in the Dallas-Fort Worth area, and I also work with Sandlot Solutions as Chief Medical Officer.
Great, thank you. So a big topic today in healthcare IT is interoperability. Tell me a little bit about how clinical interoperability helps that decision support process.
Well, decision support is really only as good as the data on which the decision process is made. If you're making that based on a single electronic health record or a limited amount of information, then that decision support system is limited. So bringing in multiple sources of information that are interoperable across the community makes that decision support much more effective and makes the users trust it considerably more.
So another big trend is new value-based payment models. How does interoperability relate to that?
Well, in order to incorporate value-based payment models, you have to be able to measure value. Now, that's going to be a colossal endeavor for all of us, payers and payees, to accomplish over the next few years because we're changing from a long-standing fee-for-service system. But if we can't measure the value, that is the quality, the outcomes, the results, the clinical benefits to our patients, and we can't measure some decreases in cost, then we can't pay for value. And so that interoperability is what allows us to measure that across the community in a way that we can then move to that type of system that rewards the value that we deliver.
And what benefits has your organization and your patients seen as a result of greater interoperability?
Well, North Texas Specialty Physicians provides Medicare Advantage patients care. We have over 70,000 Medicare Advantage patients. It's close to around $700 million of health care that we're managing each year. We simply couldn't do that with independent practices unless we had the electronic health records and the hospital systems, the lab and the x-ray all coming together in a community record through interoperability standards.
Okay. And so what advice would you give to other providers who are trying to achieve greater interoperability?
Well, there are some challenges. There is a sense most institutions, physicians are real resistant to change. We don't like sharing data sometimes, and we sometimes will make decisions that are based more on the institution interest than on the patient's interest. I sort of liken this to the airline industry. If years ago they had all decided to have their own air traffic control systems and not work together, most of the folks here at HIMSS wouldn't have made it here. Yet today, our patients are being treated on siloed information. The more we can bring that information together, the safer flight our patients can have through the healthcare system.
Excellent analogy. Thank you so much for your insights. Really appreciate it.